20 years ago, when the Community Health Fund was created, Contra Costa was a very different place. Fewer people and less diversity. Healthcare was different too. Most doctors' offices and hospitals were still using paper, not electronic health records. Few in healthcare thought about how to carefully coordinate care across settings, or about the need for widely accessible mental health care, or about the impact of food insecurity on people's health.
After an initial grant cycle in 1996 of funding numerous projects for relatively small dollar amounts, the board came to the conclusion, with the guidance of our executive director, that we needed to find a better way to have a real impact on our community. We evolved into multi-year funding with the Community Health Fund, facilitating partnerships amongst the community-based organizations and other funders. Our goal was to have a real, lasting impact.
Primary care is, of course, a primary need that has only become more important. 17 years ago, the CHF entered into an enduring partnership with La Clínica de la Raza, an outstanding provider of primary care to the underserved. Through multiple initiatives, we have helped La Clínica expand its presence, institute electronic health records, and deliver integrated primary care, behavioral health care, and dental care to thousands of Contra Costa residents who might otherwise have gone without. Another way we've extended primary care in Contra Costa is through our involvement with Contra Costa Cares, where we work with community health centers, local hospitals, and Contra Costa Health Services who help ensure those in need have access to a range of primary and preventative health care services. Specialty care can also be hard to come by for the underserved. We began working with Operation Access in 2009 to help bring specialty care to patients who otherwise could not afford it. Over the next 7 years, our support helped approximately 1,800 Contra Costa patients receive donated specialty care services and outpatient surgeries. During that time, Operation Access formed enduring partnerships in Contra Costa, and their invaluable work here continues. In 2013, Community Health Needs Assessments found a significant shortage of free or low-cost counseling and mental health services in East Contra Costa. So we embarked on the East Contra Costa Mental Health Initiative, in which John F. Kennedy University expanded its counseling center program to help seniors, children, teens, and families access mental health services. As the number of older adults in Contra Costa grows, so does the need for coordinated, continuous care that follows seniors from community to healthcare providers and back again. With CHF support, Meals on Wheels and Senior Outreach Services has expanded its work with low-income older adults by helping identify those in need of health services and connecting them through formal partnerships with key elements of the health system, including community clinics and hospitals. We've come to understand that good health is affected by many social and economic factors, not the least of which is access to proper nutrition. From 2011 to 2014, we partnered with the Food Bank of Contra Costa and Solano, and ultimately they partnered with La Clínica to distribute more than 1.5 million pounds of free, healthy produce to an average of 3,217 families per month who would otherwise have no or limited access to healthy food. Finally, for community clinics to more efficiently serve their patients, transitioning to electronic health records is critical. But it's not easy when you're working on a shoestring budget. In the last few years, we have supported the implementation of electronic health records at the Contra Costa clinics of La Clínica and Planned Parenthood, Northern California.
Developing partnerships and supporting programs like the ones just described are essential to improving the health of the communities we serve. These key partnerships and programs are especially important for the health of our community members most at risk for poor health. This work is a core part of the mission for John Muir Health and for the Community Health Fund Board and staff. We've come far in the past 2 decades, but there's more work ahead to make a lasting difference. Together, we will continue to improve access to care and address the most pressing health needs of our community. On behalf of John Muir Health, I want to congratulate the Community Health Fund on 20 years of service to our community, and thank you for 20 years of partnership with John Muir Health. Ultimately, it is our community members who benefit the most from our efforts.